Hey guys, so we're gonna talk about Mebendazole, which is an antihelminth drug. It's a broad spectrum. It's a drug with a broad spectrum activity and antihelminthic activity with less toxicity. Mebendazole has produced nearly 100% cure rate per reduction in egg count of roundworm, hookworm, Enterobius, trichuriasis, strongyloids. It is much less effective, but it's also useful for the regression of the hydrated cyst seen in the liver and prevents its regrowth. The action of the mebendazole is slow, which takes 2 to 3 days, but it causes immobilizing and its action is lethal. Mechanism of action, total 5 points to be remembered. The first one, that it binds to the microtubular protein, which is beta tubulin of the parasite, and inhibits polymerization, which leads to loss of microtubule inside the cell. That's the first point. Second is inhibition of a glucose uptake. Third is inhibition of mitochondrial enzyme and depletion of the glycogen stores. Now, glucose uptake is inhibited, which means that its conversion to glycogen will also get depleted, so that nematode larva eggs are also inhibited and Escherichia's ova are killed. So 5 points. The first one is that microtubular protein, beta tubulin, the drug binds to microtubular protein, beta tubulin of the parasite, and inhibits polymerization, leading the loss of microtubule inside the cell. Second, inhibition of the glucose uptake. Third is inhibition of mitochondrial enzyme and depletion of the glycogen stores. Fourth, nematode larva eggs are inhibited and Escherichia's ova are killed. The side effects, common side effects which we can find everywhere, which is diarrhea, abdominal pain and nausea, and allergic reaction. Other than that, there is expulsion of Escherichia from mouth and nose. Expulsion of Escherichia from mouth and nose. The probable reason could be starvation of these worms inside the body due to the drug, which leads to its expulsion from mouth and nose when there is heavy infestation. Also, there is hair loss and there is a granulocytopenia. It is contraindicated in the pregnancy, and the uses is in roundworm, hookworm, and whipworm. It is given 100 mg once a day for the 3 days, and if heavy trichuriasis infestation is there, then it is given for the 7 days. So the first use is in the roundworm, hookworm, and whipworm, 100 mg given twice a day for 3 days and 7 days if heavy trichuriasis is there. Now for the pinworm, it's 100 mg single dose repeated after 2 to 3 weeks. Trichinosis 200 mg twice a day for 4 days, and hydrated cyst 200 to 400 mg twice a day or thrice a day for 3 to 4 weeks.